Welcome to the weekly SEIU-UHW COVID-19 update broadcast. We have been doing this, as I said, weekly since the pandemic began back in mid-March. I think this is our 6th installment. We're joined tonight by 3 guests plus myself, and I should say my name is Dave Reagan. I'm the president of SEIU-UHW. And I'm pleased to have 2 of our UHW executive board members and rank and file leaders with us here this evening. And I'd like them to introduce themselves. And so, Eudice, we'll start with you.
All right, my name is Judith Cruz. I work in Cedars-Sinai Medical Center in Los Angeles. I am a CNA for 18 years.
Great. Thank you for being here tonight, Eudice. And now let's turn to DeBrew.
Hi, my name's DeBrew Carthen, and I am the lead radiologic technologist in Kaiser Modesto, and I've been with Kaiser for 23 years.
Great, and thank you for being here also, DeBrew. So since we've begun these weekly updates back in March, we've set a couple of expectations for ourselves. You know, the first thing is we want these to be a place where UHW members and coworkers and family and friends, somewhere we can come every week where we know we're going to get very, very good information, frequently from experts. But we want this to be a place where we can learn something that we might not hear otherwise. The other thing we want to make sure we're doing is really using this as a venue to share information across the whole of UHW, everything from best practices for how we approach different issues through the course of the pandemic, to just basic sharing of developments, events, and what's going on across the state of California for our 100,000 members. So we're going to do our best to accomplish each of those goals here this evening. And I want to take a moment now to introduce a special guest that we have with us. And this really falls into the category of wanting to make these broadcasts a source of expert information and hopefully, you know, facts and context that our members might not get in another way. So tonight we have with us Dr. Bechara Choucair, who is the Chief Health Officer for Kaiser Permanente, you know, for the entire company, not just for California itself. And prior to coming to Kaiser, Bechara was the Public Health Commissioner for the city of Chicago. He oversaw the public health system there. And so he is trained in public health. He's a medical doctor, has a background in epidemiology, and he's now you know, obviously working here in California with Kaiser Permanente, but we've invited Bechara to join us this evening. And before I give him an opportunity to just say a few words about himself, I want to set the stage by saying that we really wanted to dedicate a good portion of tonight's broadcast to trying to look out and think about the future. And obviously, the conversation has begun in the state and in the country really about, you know, at what point should we begin to open back up as a country, as a state, as local communities, but also for Kaiser Permanente itself. So that's where we want to begin tonight's conversation. But before we turn to that, I want to welcome Bechara to our broadcast tonight. Thank you for being with us. And, you know, tell us a little bit about yourself, Bechara, but we're pleased that you're here with us, so thanks.
Dave, thank you so much for inviting me to join you tonight. And I'm so honored to be on the same panel with DeBrew and Eudice here. So just like you've said, I've been now with Kaiser Permanente for about 3.5 years. I joined here after over 16 years in Chicago. I practiced as a family physician. I practiced in a federally qualified health center. I ran healthcare for the homeless programs, and I served the city of Chicago as the health commissioner for about 5 years in Rahm Emanuel's administration. And I'm really pleased to be here at Kaiser Permanente during this time.
Great. And I should mention, I should have said something earlier, Bechara, that you and I are also the co-chairs of the Futuro Health Board of Directors. And as our members, particularly at Kaiser, know, this is a not-for-profit organization dedicated to doing innovative and cutting-edge training of the future healthcare workforce. And so I also just want to thank you for your leadership in that domain as well. And it's been a pleasure to get to know you, a little bit outside of the normal context of the Kaiser work. But with that, I know, you're deeply immersed in the response to the whole pandemic, but it's also clear to you that we are now living in a country where 26 million people have filed for unemployment benefits in the last 4 or 5 weeks, where there's a growing conversation across the country that's getting a little bit edgy, as we've seen protests in the last few days, and the demand in some circles to, open up more pieces of day-to-day life. So if you could begin by sharing with us, based on your training and your experience, what are the things we should be looking for as a state? How do you think about really evaluating the conditions out there and what you and other people with your background and training are looking to as you think about whether or not it's time to start putting pieces of daily life back together?
Great. Well, thank you so much, Dave, for inviting me. I mean, obviously, this pandemic is a global crisis that's impacting tens of millions, if not hundreds of millions of people across the world. As of this morning, there were over 2.7 million cases, over 183,000 deaths in the world as a result of COVID-19, and where the United States continue to be a hot spot in the fight against the pandemic. I mean, we have, over lots of cases here in the United States. I think over 680, almost 700,000 cases. We've seen, we have in the United States, tens of thousands of deaths. Here in California, we've seen over 36,000 cases and over 1,300 deaths just as of this morning. So clearly this has a significant impact. And I have to tell you, I served as health commissioner for 5 years, and probably what kept me most up at night is the possibility that we might have to deal with a pandemic. Nothing is more serious than having to deal with a pandemic like we're seeing at this point. And the reality, Dave, is what we learned about pandemic, what we know about pandemics, we've learned from previous pandemics. There was the 1918 Spanish flu pandemic that cost 50 million people lives across the world. There's the 1958 pandemic, the 1968 pandemic, the H1N1 pandemic in 2009 that I was heavily engaged in during my tenure in Chicago. And what we know about pandemics is they follow a certain pattern, and that's really important. And then if you don't mind, I'd like to kind of give a quick overview of what that pattern is, because it puts the context as to where we are today as we get ready for the recovery. So that works?
I think that'd be very helpful. So please go right ahead, Bechara.
Great. So when you have an outbreak, when you have a novel virus that creates an outbreak, what happens, the first thing that we'd want to do, or the first phase, is you want to try to contain this outbreak. And that's where our colleagues in the public health sector, really are out and about trying to identify cases and try to contain the pandemic. You identify cases, you isolate those who are testing positive, you quarantine those who've been exposed, and you do what we call contact tracing to try to figure out who else has been exposed so you can test them, isolate them, or quarantine them. And usually, if you do this, in most cases, you can control the outbreak and you can contain it. Now, at some point, when the community spread starts to happen at a rate where the public health agencies can't keep up with containing, isolating, quarantining, contact tracing, that's when we move into what we call a mitigation phase. And that's really where we are right now. We're towards the tail end, hopefully, of the mitigation phase. And in the mitigation phase, you're having a lot of transmission in the community. You can't do the containment efforts anymore. So that's when you put measures in place that would allow you to do social distancing. You know, you cancel gatherings, you close schools, you ask people to work remotely, and then you could go all the way to actually having shelter-in-place orders like we've seen across the country. And I'm so proud of our public health leaders here in the Bay Area for being some of the first people to actually, the first group to actually stand up and say, we have to do shelter-in-place. You know, Sarah Cody from Santa Clara, Tomas Aragon from here in San Francisco, and others are just fantastic leaders in our community. So when you are in this mitigation phase, you put these measures in place, and what you're trying to do is you want to slow the community spread. And probably everybody has heard now of let's flatten that curve. And what flattening the curve is really about is you'd want to slow the community spread. And why do you want to do that? You want to do that for 3 reasons. The first reason, which is very relevant to all of us on this live stream here tonight, is you want to give the healthcare system enough time to prepare for the increased number of patients who will be coming to our healthcare system. So you'd want to make sure that we're having enough PPE, we're adding hospital beds, we're adding ICU beds, we're making sure we have enough ventilators. All of those are really important in what we call the surge preparation, so that when we have more and more patients coming into our doors, we can take care of them and they don't have to suffer because they don't have access to the healthcare system services that they need. So that's an important part of why we actually slow that community transmission. And then the other 2 reasons is you want to gain time so you can learn what works from a treatment perspective, hopefully get a vaccine up and running. And I know at Kaiser Permanente, we're engaged in both of those. You know, we're looking at what works for treatments, and we're also engaged in the vaccine. Now, towards the tail end of this phase, when your social distancing efforts are working, the community spread goes down, that's when the number of new cases starts to go down. And that's when we enter what we call the suppression phase. And that's the phase that we're getting ready for. You'd want to suppress the pandemic. And really, when you start seeing cases, you'd want to go to those cases, isolate them very quickly, do contact tracing to those folks to identify other people who've been exposed, test those folks, quarantine them, isolate them, and make sure that we're suppressing the virus. And that's a really, really important phase. Now, when we're successful in this phase, then you start thinking about how do you prevent recurrence of this pandemic. That's when hopefully vaccines will be available, and we're going to have a long journey in making sure that the vaccine is there, it's safe, it's effective, and getting people to be vaccinated. So those are kind of like the 4 stages, if you want, Dave. Mm-hmm. And I think we're now towards the tail end, hopefully, of mitigation, and we're going to start getting ready to suppress this virus. And with suppression comes the opportunity to reopen, what we call Let's Reopen America. That's really what that is about. And we have to be very careful, because once we start modifying those social distancing measures and people start going out and interacting and spending time together, if we're not really careful, it's likely that we will see more surges. And what we've learned from previous pandemics is the next phases or the next peak could be as dangerous, if not more dangerous, if we're not really careful. So that's my public health 101, pandemic 101 here tonight.
Okay. So I think one of the things, and correct me if this isn't accurate, Bechara, but one of the things that's very different is just the sheer number of people who are infected with COVID-19. And so, as you said, the numbers I saw today we're now approaching 40,000 confirmed cases in California. Some unknown number of cases, because we don't have enough testing capacity in place. Everybody believes there's a substantial additional number who are infected. From your perspective, what do you look for in terms of the growth of new cases? How many new cases a day in a state the size of California? Give us maybe a benchmark that's meaningful to people in your field to think about, at that point with X number of new cases a day, we can really suppress this.
Yeah, so actually, Dave, this is such an important question, and that's really what's going to drive our ability to be successful at suppressing this pandemic. And it really starts with testing. And you've mentioned that in your question. If we don't get our arms to step up our testing, we're not going to be able to understand how far spread this disease is in our community. And that's so important that we do that. And let me just give you an example. We expect that right now in the United States, we do about 150,000 tests a day. And for us to be able to get to a certain level of comfort with really understanding how far spread is this condition in our communities, we need to be testing a minimum of 500 to 700,000 people every day in this country. And we're not there yet. And that's what keeps me concerned about the ability to get to be successful in the suppression phase. So let's take some more specific numbers if you want. We expect that for us to be able to get comfortably into the suppression phase, we should be doing about 150 tests per 100,000 people per day to be able to get us comfortably to suppression. We're at about 46 as a country. We're about 45 tests per 100,000 per day. So we have way to go there. And here in California, we're at about 26, 27 tests per 100,000 per day. So unless we step up our testing capabilities so that we can understand who's really infected, so we can isolate them, treat them, isolate them, quarantine those who's been exposed to them, and then do that contact tracing so we can figure other people, it's going to be hard to put our arms around this pandemic.
So if you could, I read this week that a number of the reputable models that are used, you see this University of Washington model, and there's other models that people are looking at out there, that they're saying, but it's based on having enough testing, having the ability to do contact tracing, that by mid to late May, that from an infection standpoint, just the development of the disease, you would be able to start thinking about returning to normal life. But there's this tension because we have to quadruple the amount of testing that we have in California. We have to triple the amount of testing in the country as a whole. How do you evaluate those two tensions, that the disease itself is developing in a certain way? The models are saying mid to late May, but is our testing capacity and is our contact tracing capacity, and frankly, do we have the supplies for the healthcare workforce to be able to start, reintroducing what we'd all say is normal conditions?
Yeah, thank you. I mean, such a great question. And the reality, and what I've been telling everybody, is we really need to make sure that the science is driving those decisions and the data is helping us to drive those decisions. It's going to be a journey for us to get back to quote unquote normal. I'm not sure, the reopening America, it's not going to be the same as when we ordered everybody to shelter in place. We have to be thinking about a gradual approach to bringing us back to normal. I would anticipate that probably most large gatherings will remain prohibited. I would assume that some industries will open faster than other industries. I would anticipate that we'll continue for a while to encourage people to telework and do the, not be there in person if we can do the work through telework. I think we're going to see a lot of push for thinking about physical distancing in the workplace. And we need to start thinking about how we educate our workforce about the importance of hand washing. How do we make sure that we, we're having some screenings and protocols in place so that we are protecting the workforce as a country when we get back in. So I don't think that getting back to normal is going to be in a flip of a switch. It's going to take a while. It's going to be a gradual approach. And Dave, honestly, we have to be able to have a robust surveillance system that tells us when we're going to see the next surge. And maybe it might not be as broad as the full United States as we've seen recently. It might be in micro geographies, but we need to be able to have the surveillance systems that tell us there might be a hotspot that's coming up in this community. Let's figure out how to reinstate our social distancing measures in that community. And it's going to be a while for us to until we get to have the vaccine and effective treatment. It's going to be a while where we're going back and forth, if you want, to ensure the safety of people living in this country.
Okay. So if we could just sort of close this section, if you could respond to the following, Bechara. And obviously most of the audience for this live stream are healthcare workers themselves, including lots of Kaiser Permanente folks. And when we think about, and when we're thinking about how do we look to the future, right now, what's first and foremost in the minds of our workforce is, are we going to have the proper PPE supplies deep into the future? And, we're all aware of what's been happening. So there's that. What should we expect will be different, or, in terms of work itself, and, not just at Kaiser, but perhaps at other places. So I guess what I'm asking is if you could give us your thoughts as people who work in hospitals and healthcare institutions. What can you share with us about your views on the supply of PPE going forward, about what healthcare workers themselves can expect, and then what role is Kaiser trying to play in terms of being a leader in the entire system in California?
Yeah, so let me just start by saying anything that would, as I think about what would it take to reopen the healthcare system in the country, and I'm not just talking about KP, I'm just talking about just in general in the country, we've seen deferring of elective surgeries, elective procedures, a lot of things are being pushed far so that we are protecting the PPE utilizations for our workforce that's particularly interfacing with patients who have COVID. As I think about what would it take to reopen the healthcare system as a country, I think about 4 key elements, if you want. First and foremost is, to your question, do we have enough PPE? Do we have enough PPE that would support our workforce to make sure that we're doing the best we can to protect our workforce? The second question is, do we have a healthcare system that's going to be able to handle a surge that might pop up? And we know those surges will happen. So are we having a healthcare system that's ready to surge very quickly to be able to meet the demands of our patients and our members? The third question I think that's really critical is, how do we think about the surge need at a regional level? It's not just one hospital on its own, or one health system on its own, or one medical office building on its own. We have to be thinking about a coordinated regional approach so that when a surge happens in a hotspot, the full community of healthcare systems is coming together and is able to support people in that community. And I think the fourth piece, Dave, that I think about it is, do we have the right systems in place to ensure employee safety when we're all coming back? I think we have a fantastic set of frontline workers that I can't be more proud of. Are going day in and day out taking care of our patients. And we have a lot of workforce that's working from home. So how do we make sure that, and also they're doing a fantastic job in very trying times to support our members, our communities, and each other. So I think making sure that we have the right systems to protect the workforce is going to be critical as we move forward. And I do have to tell you, I was reading one article the other day, and there was a quote that caught my eye from one of our healthcare workers. I think she has like 24 or 25 years experience, Javon Christian. And she said, this is a crisis and I'm not gonna let it stop me. I'm here for my patients, I'm here for their families, and I'm here for my family. And when I read that quote, it just gave me goosebumps, because this is the reality of our frontline workers who are going in and day out and being there doing an incredible job for our members, not just as a caregiver, but also as an emotional support system for those patients of ours and members who are in the hospitals in their most vulnerable times and not having their families around. And to be able to see our colleagues stepping up and being there for those members, not just for the incredible healthcare that we deliver, but also for that outstanding emotional support that's most needed, makes me so proud to be part of Kaiser Permanente.
Great. Well, Bechara, I know this is a complicated topic, and I really want to thank you for joining us here tonight. We're going to continue to work hard with Kaiser to make sure we're doing everything we can to keep people safe and get ready to face the future together. So again, thank you for being with us, and we look forward to collaborating with you and others into the future. So,
right. Thanks, Dave. Thanks, Debrew, and thanks, Judith. We'll be in touch soon.
Great. All right. So I want to turn now to Eudice and Debrew, and I want to begin this section of the conversation by sharing with everybody that we put, on this question of how do we think about reopening and trying to restart a more normal set of activities. And so we've had this question up on our website for the last day or so, and we've had well over 2,000 of our members respond. And it's interesting that with over 2,100 people voting, so to speak, well over 1,700 have said that we should not move to reopen our hospitals, our health systems, or our state until we really feel confident that this is under control. So with 1,700, which is do it right and take the time to do it, versus about 350 who said we should open right away. And so if you turn that into a percentage among the UHW members, 85% on our survey on our website are saying take your time, do it right, versus 15% saying go forward and start to reopen now. So Eudice, if I could start with you, you work at Cedars-Sinai, and if you could speak to the issue of PPE and how that's looking from your perspective and with your coworkers at Cedars right now, because I know you've had some experience with that in the past week or so.
Yes. Unfortunately, my son was one of the first one that got infected with the COVID-19. He got positive. He also worked on Cedars-Sinai as a transporter. And one of the things that we saw at the beginning was the, shortage of PPE. At the beginning of this pandemic, crisis, that was the most, scary things for everyone as healthcare workers, because we didn't have enough PPE. So I think with all the issue that we have, referring to people getting infected, and not only patients, but, co-workers, because of the shortage of PPE at the beginning. Right now we okay, but if we start open up, again, like open everything, I think it's going back, because we're not ready for that there yet. I think we need to wait. We need to be stable and see if we're really, ready to open. Right now, I don't think it will be another crisis. That's my point of view right now. All my coworkers have concern of be open again, concerned of how we're gonna do it if another wave of patient come into our hospital. And it's just scary. It's just scary because right now we have coworkers which is they're not seeing their families because they wanna we work direct with COVID patient. We working with patients that are positive. That's what I'm doing right now. So coming home, we have to take all the precaution because we don't want to get our family sick. And that is, it's all my coworkers are the same thing. So we're really concerned of open business and open everything, even though it's little by little. Probably, it will be less, but still scary. So I don't think we're ready to open now. I think we need to see the numbers of people infected down in order to open up, back to the way we were.
Okay. And as I said a moment ago, that your personal perspective is one that about 80 to 85% of UHW members are expressing, in the last day or so in the survey we've taken. I just want to add, just to try to be as clear as I can, that across UHW, we're trying to establish some criteria for how we think about this question together, and what should the criteria or the evaluation points be. And first is we have to feel confident that there is an adequate supply of PPE equipment. And it's a little bit different, employer by employer, system by system, because the surge hasn't happened in the way that it was originally predicted. We were originally told there were going to be more patients more quickly than what we've seen. So we feel like we have a little bit of a hold or a little bit of a foothold on the PPE, but we want to be confident that before we go wide with opening up services that exists. The second thing that's really important, and Bechara talked about this, is there has to be the ability to test the workforce much more broadly than has existed now. And I do want to say, Eudice, you work in Los Angeles. The mayor of Los Angeles announced today that there would be the ability to get healthcare workers in Los Angeles tested whether or not they have symptoms. And so that's something we want to be following up on in the coming days with all of our members. And we also want to make sure that we have the appropriate supports, including mental health supports and counseling supports, because as you know, and as DeBrew knows, that this really strains people and it really weighs on people to keep going to work every day and dealing with positive patients and dealing with all of the special circumstances. And then the final thing I wanted to mention, and we've really said this across UHW, is that with the federal aid that's been coming to hospitals, we think it's very important that the lack of finances should not be used as an excuse to either lay people off or reduce services going into the future. Hospitals are being supported by the country as a whole in terms of dollars, and it's important to us that we remain whole and that our jobs are there on the other side of this. So I just wanted to share that. I now want to ask DeBrew if you could speak to, that set of issues, DeBrew, and I'm aware that there was an example in your workplace of the kind of thing that we don't want to see happen in the future. And I know you know what I'm alluding to, and I'm asking you to share that story as part of your reaction for, everybody watching.
Sure, Dave. So what happened in my workplace, it was during the early times of us finding out about the COVID. I have a coworker who has been out of work almost 30 days, fighting because this coworker ended up being positive not in a regular kind of, I guess, patient care area, but she's in a patient care area. And we are fighting because she has to fight for her workers' comp. This is before screening, where we have now the ambassadors and greeters who will not let you in the door if you have certain symptoms. And this was before all this. This is before the plexiglass was put up. And now we have people who are fighting, who are close to all sick gone, no vacation left. And as a contract specialist, I am fighting for her to make sure that, you know, that employee gets compensated and gets the admin pay, because this is work related. And if, you know, when I'm thinking of, you know, let's start things back up, we still are not, this case to me is showing that we still don't have an understanding of how this is easily contracted from someone sneezing and coughing on you, or you touching something and touching you. We're not ready to reopen even slowly. We really still need to get a handle on this. We need I'm really excited for LA with the testing of the healthcare workers, but we really need to get that in Northern Cal too, because people can be asymptomatic and pass it along. And we just really need to make sure that our frontline staff is covered, and that they're taken care of, and that we don't have to fight once we get sick from a pandemic that it blindsided us. You know, we were not prepared, and we still are semi not prepared. So I'm fighting for my coworker, and that's what me and my other coworkers will continue to do. I was just thinking, you know, I have vacation saved up. I can transfer some vacation hours to that employee because she has nothing. And she is the head of a household. So it's really a fight. And hopefully, once things get escalated, we can right this wrong.
And so, DeBrew, if you could just give a sense, you know, with your workplace and the people that you're in communication with, I'm sure this conversation about, you know, when will it be, you know, time to reopen or think about adding services, just give a sense from your coworkers and your contacts, you know, what's that conversation like?
So we have leadership calls, and it was mentioned on one of our recent leadership calls of what was, from a labor perspective, the employer was asking, what did we think? And we had a call with labor after that, and the main issue is right now we're barely letting anyone in the building. And with a slow open, what does that look like? How would we let more people come in and still protect ourselves, protect our members, protect our families? It's scary because we don't know what that will look like, because we have been doing the social distancing and keeping away from each other. We have, you know, tape in certain places so you can stand the 6 feet away. We've developed where, you know, we are not having so many people in the pharmacy, and just the thought of more people coming in, and with hearing the testing levels, we're not there yet. So it's just really scary, just because we don't have what we need. We're not halfway to where we need to be to make sure that we can open up the doors, and even slowly. We understand the economics because the hospital is a business, and we know that the elective surgeries is how we make a lot of our money, but we have to make sure that we're protected first.
Right.
Yeah.
So you know, you mentioned economics, and really as a point of information, I just want to share with everyone here tonight, you know, as this conversation has developed, you know, just in the past week in California and around the country, there's, you know, been a lot of talk about the number of people who filed for unemployment, 26 million across the country, 3 million here in California. And there's also been stories in the press about the, you know, the extra money that's coming from the federal government to supplement unemployment benefits. And I know, you know, whether it's UHW members themselves or family members or friends, that, you know, people, everyone knows people who are having to try to get those benefits. And I just wanted to be clear, if people may not be aware, that the supplemental benefits will exist until the end of July. And that's, you know, in addition to state level benefits. And so, you know, as we think about the need to reopen, we just have to bear in mind that there's been acknowledgement of an extra level of financial support that's been part of the relief packages from the federal government that, in terms of unemployment, at least gets us to July. Eudice, I just want to give you an opportunity, the same as DeBrew, if there's things in particular that are on the minds of your coworkers at Cedars-Sinai. And then after that, I'm going to ask the moderator. We try to just, you know, be responsive to the kinds of comments we've heard in the last week or so from members across UHW. And so we want to just deal with some topics that are clearly, you know, on the minds of people collectively. But anything else you'd like to add about Cedars, Eudice?
Yeah, I would like to thank all the healthcare workers, like doctors, respiratory therapists, nurses, CNA, EVS, transporter, food and nutrition, and all other departments that are working at the hospital right now fighting against coronavirus. You know, this is a hard time for us, and we have to be there because we love what we do, but at the same time, we have to, you know, take care of ourselves, take care of our family. And I understand that we want to be home, but because we love what we do, we also want to be in the hospital, helping, you know, the people that are sick because of this. And I just want to thank for all the healthcare workers, that include everyone that, you know, that remain in the hospital, all the departments that I open, not even not only in Cedars, but all the hospitals that still open. So it's hard for us not to expend the time that we want with the patient. It's hard for us not to be able to shake hands with them, not to be able to, for them to see our face. We see them, but they can see us. It's hard because they feel alone, and it's hard when they stretch their arm and they're trying to hug you, and you can, you know, you even though you cover, you're still afraid of them. You know, my floor is all positive. So we really, all my coworkers are working hard from our heart for the patient, for our patient. And I just want everybody to understand that it's not easy, but we need to be there. And it's not easy for us. And I just want to thank all the healthcare workers around the world.
That's great. Thank you, Eudice. So moderator, I know there's some topics that really seem to rise above the ordinary, you know, level of what people are concerned about. And so I'd like to ask if there's particular items that, you know, viewers and members are looking to have discussed on the broadcast tonight.
Sure. So just on this topic of reopening, we did have some number of people comment that felt like we should begin looking at reopening, and I'll just share some of these comments and for the reaction of the panelists. So Katie Felt wrote, elderly and immunocompromised people are welcome to stay home, but so many people are losing their jobs. Sometimes the cure is worse than the disease. Yes, people are dying from suicide right now too, as all they have worked for is disappearing. It's easy for us to suggest we stay closed when we have jobs in healthcare. So question just for the panelists, just to react, obviously it's already discussed a little bit, the tensions that people are facing around the economic impacts of the pandemic and the shelter in place. So I just want to give people an opportunity to react to this comment.
DeBrew or Udis, would either of you like to respond to that?
I'll respond.
Go
So
ahead.
I definitely accept what was said by the member. Governor Cuomo is in my head right now, and I watched him the other day when he talked about death cannot be the cause for us to economically reopen up things. Death can't be the outcome. There are jobs. I personally, I understand that there's people who are losing things. My husband lost his business. I get it. I am the head income maker right now because of the pandemic and the economy. I get it. I totally get it. We have to search our mental health. We have to reach out. We have to stay connected virtually with people. But that person might be losing some income, but they have not lost their life. And if they have not lost their life, there's a chance for them to rebuild. We never would have thought that at 47, 48, we could have a chance to start a new career. So definitely don't want to take it lightly that people are losing their jobs. Our mental health services are very important, and we really need to tap into it. We really need to connect with family and friends and just, be a comfort. But I would prefer to be able to virtually talk to you than to not be able to talk to you at all. And that's just my view.
Okay, thank you, DeBrew. Udis, I know you wanted to comment on that also.
Yeah, I just want to say that life is more important than, economic. Of course, economic is important, but not life. Also, like my husband also lost his job because of this. Hopefully, he get it back later, but right now, I also am the main income in my family. So we're not ready to reopen, and life is more important than anything else.
Okay. And I, like DeBrew and like Udis, I think the question, really does reflect a deep tension that we're all trying to come to grips with. But even, I know DeBrew and Udis both commented about, obviously the importance of life and health and all of that. But I think also just from the economic perspective, and there's no question that people are suffering and people are losing jobs and losing income and losing savings. But one of the things that I try to remember is how can we be a set of leaders in an organization that makes a contribution that we want to go through this once. And what I worry about, because of those pressures, those very real pressures, that if we try to restart too quickly and everything flares up again and we actually find ourselves in a worse position and the economic problems get intensified and then drug over a longer period of time. And so I am certainly sensitive to the economic issues, and I want to just remind people that we as an organization are being very mindful that healthcare workers ourselves are literally risking their health and risking their life. And it's very, very important to us that our jobs and our livelihoods are going to be maintained. But we want to go through this once and not have to go back and forth as we have unnecessary flare-ups. So I appreciate the question. It's one that's on everybody's mind, and we're starting to grapple with that as an organization. So moderator, do we have, I'm sure we have others that people are thinking about.
Yeah, here's a question from Ruth Robledo. Says, I work with patients who get elective surgery. With that stopped, I don't have hours. Do I have to use my own PTO before applying for unemployment?
So there's always individual circumstances here. I'm guessing that the answer is basically yes. That we have to find ways to, if we're not actually laid off, to supplement our hours and supplement our income. And this goes to the question that was just asked, from by and large the perspective of people who are not healthcare workers, but we have members, who are getting, fewer numbers of hours and not getting all of the income that they would normally have. I do want to say on the question of elective surgeries, and people are probably aware that yesterday Governor Newsom in California announced that what you might call, it's not the right word, but not high priority elective surgeries are going to be able to get resumed. Not cosmetic stuff, not stuff that, could be put off indefinitely, like a knee replacement, but heart procedures or other procedures where if you don't get that done soon, there could really be negative consequences to people's health, and that those are already starting to be brought back, not in huge numbers, but be brought back online, because there is recognition, that there are conditions and there are patients out there who really do have high priority issues that are not COVID that need to be addressed, and that will do something to, bring back surgeries that have not been taking place for the past month or so, although it still will exclude a set of procedures that are truly elective. So I don't know, DeBrew, Udis, if a comment on that, or if not, well, we got the moderator. Let's see what else we got on people's minds.
So we had a number of concerns or questions raised specifically around N95 masks, and in particular with Kaiser rolling out new guidelines. So Vivian says, hi Dave, if we have N95 masks now, why are we having to reuse the masks and face shields? Cesar adds to this, what is the lifespan of an N95 mask? And some members did respond and said you could use it up to 5 times, but just want to open it up for the panel to just address this larger question around perhaps the new guidance from Kaiser and just what we can share around N95s.
So DeBrew, would you mind, being a Kaiser member yourself, give your perspective? And
I know within the Kaiser system, they are re-sterilizing a lot of the N95 masks. We got on our labor call with the COO and the CFO and the AMGA within the Kaiser division, and some of the infectious disease control doctors, that they could be re-sterilized up to 3 times unless they're torn or if there's makeup in them that can't be sterilized. We did get a surplus of masks, but we are not at the surge yet. We don't know how hard the surge is going to hit us, so that's where the ask is right now, to reuse the mask or to have the mask re-sterilized, because once the surge hit, if we don't constantly get more masks, then we're in trouble as healthcare workers majorly. Right now, we're really low in the surge. And like where I'm at in the Central Valley, it hasn't even hit yet. But if we are using the mask in the way that we normally do, we won't have it by the time the surge hit, and then we'll have a real problem, because we're having major issues getting the mask right now. I know it was reported on one of our calls that China has seized a lot of the production of some of the masks. So we really have to be careful with what we're doing with our masks. Until we start making them here in America at a big volume, we have to preserve what we have.
And I should just add that, on a Kaiser specific note, and this is a little bit different than what the question was, but we were also raising the issue inside of Kaiser that all healthcare workers and all UHW members who were interacting directly with COVID patients, whether you're EVS, whether you're a respiratory therapist, whatever your classification, that it should just be the standard that everyone gets an N95, not that, for instance, EVS workers don't get them. And that procedure or that protocol did change this week, and literally in the past 2 days, Kaiser broadly, it's hard always to say if it's 100%, but broadly has really been changing their practices. And as DeBruce said, that's the tension there, is on the one hand, we have, really insisted that the best masks be available for everyone, irrespective of their job classification. At the same time, we're recognizing that we will do some of the reuse and the re-sterilization to a limit of 3, as DeBru outlined, because we still don't know exactly what the future holds, and we don't want to get caught short. But it is important to note that we did make progress on establishing a standard that all healthcare workers, all UHW members dealing with positive patients are going to be able to get the N95s. So we hopefully have time for at least one more from the moderator. And
yeah, so a couple different questions come up just again around loss of pay or reduction in pay. So Deanne asked, is there any discussion about temporary reduction pay like Stanford announced this week? Another member asks, can a member be let go if there's no work for a certain period of time? Would people lose their jobs? And this has been thematic for quite a few concerns of members.
Yeah, so on the question of can you be laid off, and I'm going to assume that's what the question meant about in terms of losing your job, that is really an employer by an employer conversation, and it really does depend on your local contract, your local collective bargaining agreement. We have articulated that our goal and our position as a union in UHW is that we are going to oppose any efforts to lay people off and to reduce the workforce, by putting people out of work, either indefinitely or permanently. We feel very strongly that healthcare workers in this environment really are acting heroically. People really are being heroes and risking their lives. And we are not going to stand for those same folks then being told that you're not going to have your position. Having said that, it is the reality has been acknowledged that because elective surgeries aren't taking place and because most hospitals were gearing up for a surge that hasn't hit at the level that we were expecting, that there is some reduction in hours in certain of our systems and certain of our hospitals. We are working to negotiate. The question referred to an agreement we reached at Stanford. We are having discussions with all of our employers. We're getting, outcomes that are a little bit different in different places. So this really is something that has to be followed up on an individual level. But then I should also say that we've been in touch with the state of California. We were really working hard on childcare and temporary shelter issues. And now I think we're getting into the point where we're looking at, issues around potential hours reductions, potential layoffs, that type of thing. So I think it's our sense as an organization that we're moving into that phase, this next phase of the overall response to the pandemic. We know that work and the ability to continue to earn a full income is top of mind for people. Again, we're going to resist any efforts to lay people off. We're going to continue to work to negotiate enhanced benefits or enhanced pay. And do the best we can to make that as consistent as possible across the organization. So I'm mindful that, as always, the hour goes very, very quickly. We're happy to follow up with people, through your rep or through your division staff or your contract specialist, as the case may be. But before we conclude tonight, I wanted to give both Eudice and DeBrew an opportunity for any closing thoughts. And so we'll start with you, Eudice, and then DeBrew.
I just want to thank everybody to, let me be part of this conference. And thank you, David, and all the ones that we were here. And same thing, just, trying to do our job the best that we can for our patient.
Great.
Thank you.
Thank you, Eudice. Thank you. DeBrew, closing thoughts?
I just want to thank everyone also. I want to just say to my SEIU-UHW brothers and sisters, no matter if you're hospital division, Kaiser division, we are one union, it's one voice. We need to definitely support one another. In trying times, it takes leadership. We all have leadership skills. I am so proud to be a part of you guys, and I'm honored to serve. So we will get through this. We're going to move forward, and we're going to work together. Thank you.
Thank you, DeBrew. And the last thing I want to say, I just want to remind everyone that there's lots of information on our website, www.seiu-uhw.org. It's constantly updated, resources, information, it's all there, and we want to encourage people to make the best use of that they can. So again, I also want to thank people for taking time this evening. We will do this again next week. Be safe, look out for each other, and as DeBrew said, we'll figure out a way to get through this. So thank you, everybody, and good night. So long.